So today we're going to explore how to write the methods section of the research proposal, which is a critical part of your research process, especially, of course, in mental health and education. So whether you're researching therapeutic techniques or educational interventions, the methods section will describe how you plan to collect and analyze data to answer your research questions. So we'll break down the key components of the methods section and go through tips for writing each part effectively tonight. So, okay, just to recap, a research proposal, the thing that's due in our last class together in our next class, is a document you write before conducting your research. So it outlines what you want to study, why it's important, and how you will go about conducting the study. So the method section is an integral part of this proposal because it details how you will collect data and analyze it, ensuring that your study is replicable and ethical. The method section is the heart of your research design. Its purpose is to provide enough details so others could replicate your study. In a professional setting, particularly in mental health or education, being clear about your methodology is essential for maintaining research integrity. You'll want to describe not only how you will collect data, but why you've chosen these methods. And this builds trust in your research and shows that your methods are scientifically sound. So the methods section has four primary components, and we'll go through in detail each one, but it's participants, materials, equipment, procedure, and data analysis. Each of these parts serves a distinct role in describing the structure of your study. So for participants, who are you studying? This includes the demographic information, the sample size, and recruitment strategy for materials and equipment, what tools you'll use, such as surveys, assessments, or specific software. Procedure, the steps you'll follow during data collection, explaining exactly what happens during the study. Data analysis, how you plan to process and interpret the data you collect and which statistical or qualitative methods you will use. So, when describing participants, you should provide clear details about the people in your study so others can understand how your sample aligns with your research question. So, sample size, how many people will you include? This is important for ensuring the reliability of your findings. Sampling method, how are participants chosen? Random sampling or a specific criterion. For example, teachers with five or more years of experience in a particular area. Inclusion exclusion criteria. So, what characteristics must participants have to be included? For example, a certain age, a specific diagnosis in mental health, perhaps, or eligibility for a specific education program. Recruitment strategy. How will you find participants? Are you going to recruit through ads online? Are you going to partner with schools? Are you going to reach out to mental health clinics? What's your method in this recruitment process? So, this next section describes the tools you'll use to gather data. So, in mental health and education, materials can include anything from standardized questionnaires and diagnostic tools to educational assessments and case studies. Um, It's important to mention if the materials have been tested for reliability, meaning do they measure what they are supposed to measure consistently? And validity, do they truly measure what they are intended to measure? So, examples in education, you might use standardized tests. In mental health, you might use diagnostic assessments like the Beck Depression Inventory or certain DSM 5 criteria. Procedure section details the exact steps you'll take during your research. So think of this as your roadmap for data collection, your step by step process. So be very specific in describing what will happen from start to finish. What will participants do when they arrive at the study site? Will they be given instructions? How will they complete the assessments? Settings and environment. Where will the study take place? In a controlled lab environment, unlikely for everyone here, at a school or clinical setting. The environment can influence the results, so it's important to include details. And duration, how long will each participant be involved? Are there follow up interviews or multiple sessions? Instructions for participants. So, what instructions will participants receive? This helps set expectations for them and ensures uniformity in your data collection process. So, now we'll move on to how you'll handle the data once it's collected. So, you want to think about, are you planning on collecting quantitative data, numbers and statistics, or qualitative data, themes and narratives? So, understanding the type of data helps determine which analysis method to use. And so, for quantitative data, you'll describe which statistical methods you'll use. And for qualitative data, I want to hone in on ethnography as an example of just one example of qualitative data. So, as we know, unlike quantitative research, ethnographic data analysis isn't about numbers. So, in this case, if you were choosing to do an ethnographic research project, you would be writing in your data analysis how you'll be looking for patterns in the stories and behaviors you observe. You will use methods like thematic analysis or narrative analysis to interpret your field notes and interview transcripts. In terms of coding, ethnographers code their data often to categorize themes or behaviors. So this could involve identifying specific words, phrases, or actions that reflect the research question. So, for example, in studying a school setting, you might code data based on teacher student interactions or classroom management techniques or student behavior. Um, and then you would be writing that as you analyze data, you'll be remembering to reflect on how your own experiences might shape your interpretations, constantly asking yourself, how am I interpreting this data? Because we know that's very important in ethnographic research. So ethics are a vital part of research, especially in sensitive areas like mental health and education. In terms of informed consent, you want to ensure that participants know what the study involves and agree to participate voluntarily. You should include how they'll be informed and how their consent will be documented. In terms of confidentiality, you'll want to explain how participant data will remain confidential. Will their personal information be anonymous, and how will data be stored securely? In terms of risks and benefits, what risks might participants face? In some mental health studies, participants may experience emotional discomfort. How will you address and minimize these risks? And debriefing. What happens after the study is over? Will participants be debriefed or explain this or to explain the study and any potential impacts on them? So you want to be clear and concise when you're writing this up. Avoid jargon. Use simple language to explain your methods. Your goal is for someone else to read it and be able to replicate the study. Um, the method section to describe your plans as if the studies have, uh, it should justify your choices, like why you've chosen specific methods. For example, why did you select a particular assessment tool? This is especially important in mental health and education. Be transparent. Discuss any limitations of your methods. If you think your sample is going to be small or unrepresentative, acknowledge it. So here are some common mistakes to avoid when writing this method section. Vagueness. Make sure your procedures are detailed and not overly general. On the other side of that, overcomplicating things. So don't use unnecessary technical language. The method section should be understandable to any researcher. Of course, you don't want to neglect ethics, so make sure you'll clearly state how you'll handle ethical considerations. And of course, this is a non negotiable in psychological and educational research. So, in summary, the methods section is essential to any research proposal, and of course, yours that's coming up. It ensures that your study is replicable and scientifically valid, such that it is. Remember to include clear details about your participants, materials, procedures, and how you'll analyze your data. Justifying your choices and addressing ethical concerns are also key. So, of course, good luck with your proposal and make sure to follow these guidelines as you begin to draft your own method section. And I will take questions in just a moment.